Hi everybody, welcome back. This is part 2 of how to plan a flap for the free gingival graft. And in the previous video, I showed you a case from Dr. Ahmed from Egypt that involved the lower incisors with some mucogingival problems with a Freenham pull and some poor tissue quality. And I gave you a description of what's going on and, in my opinion, what are the interactions between the different factors. So if you don't fully understand it or you didn't watch this video, go back and watch part 1 because the diagnosis and the understanding of the problems and why this is a problem is very important, actually more than the treatment. So in this video, we're going to be more specific about what are the options to treat these problems. Now, before we get hung up on what type of treatment and more the surgical aspect of it, I urge you not to forget the basics. If this patient has an oral hygiene problem and some inflammation and periodontal concerns, definitely start with initial therapy with scaling and root planing, oral hygiene instructions. And because this patient has some orthodontic issues, I would recommend an orthodontic consultation to explore what are the options. Your surgical decisions are based on that as well, because you may find yourself treating a localized problem and missing out on the whole picture. So what are the options in terms of soft tissue grafting? What are the mucogingival treatment options? That depends on the goals. In the previous video, I talked to you about the problems that we're seeing in this patient. We saw recession, inflammation, poor tissue quality, and also Freenham pull or Freeney pull. And I think we need to relate the options to solve these problems. So in my opinion, we definitely need to eliminate the pull of the Freenham. That would be a great idea. We would like to improve the tissue quality because that's a contributing factor to the problem. And it would be great to have root coverage if possible, though it's not an aesthetic issue typically. But if we can regain some of the attachment to where the tissue used to be originally, that would be a great idea as well. The reason it's in a question mark is that the low incisors are notorious for being challenging in terms of root coverage. And that's coming from a specialist in soft tissue grafting. Even at the hands of the specialist, this is not always an easy task to achieve because there are so many factors that are playing against us. Anytime we're trying to position tissue in a coronal direction, if you have muscle or mucosal pull, it's a problem. If you have poor tissue quality, it's very hard to manipulate the tissue. There's risks of perforations and tearing, and definitely the position of the tooth in the arch, which is many times in a very buccal direction with complete or partial dehiscence, where the tooth is to some extent outside the bony envelope, is a challenge in terms of soft tissue grafting. So root coverage is not an easy thing to do, and that will play a role in our decision making. So going back to Dr. Ahmed's dilemma between a free gingival graft and a connective tissue graft, and if you're not 100% clear on how these procedures work, go back to my YouTube channel or some of the emails I sent you in the past on how the free gingival graft works and how the connective tissue graft works. These are separate videos that go over these techniques in detail and explain more. And it'll be important for you to understand so you can make a good surgical decision. So go back and watch these videos, even for a quick review. So when you're contemplating between a free gingival graft and a connective tissue graft, it's not an easy decision. Both procedures have pros and cons. There's no right or wrong. Occasionally we combine the two. And the final decision is after you took all the factors into account, you factored in the patient's goal, what's realistic to achieve, and also, of course, considering the problems, which procedure will solve the majority of all problems. And I never found one technique to solve all of the problems, at least in a predictable way. Another important point is when we talk about a free gingival graft, we typically talk about a very well-defined surgical approach that keeps repeating itself over and over in different cases, pretty much the same. When I talk about connective tissue grafting, there are a lot of variations on the theme. There's the classic approach with a split thickness flap, envelope flap, vertical releasing incisions, using the connective tissue in a tunneling approach of different kinds. So when I say connective tissue, it's really an umbrella term for many, many different types of techniques, which I'm going to explore in the future and create some training for. But in this video, we're going to talk in general terms about what are the advantages and disadvantages for this specific case. And in the third video, I'm going to give Dr. Ahmed some practical advice on a flap design. So when we talk about the free gingival graft, which is an autogenous graft taken from the heart palate, this graft can improve tissue quality because the nature of the palate that it's very thick with dense connective tissue. So when this tissue gets transplanted elsewhere, the tissue will be of good quality and thickness. Now, the palatal tissue also has significant keratinization. So again, when you transplant a free gingival graft, you are increasing the zone of attached and keratinized tissue, which is very necessary in this case. In the same process, and this is part of the flap design, you will eliminate the frenum or the freni. And in my experience, areas that have an increase in attached and keratinized tissue with increase in tissue thickness and quality when the frenum is eliminated will be usually very resistant to further recession. So these are the main things you can achieve with a free gingival graft. When you think about a connective tissue graft, it does improve the tissue quality because, after all, it's taken from the palate as well. You'll see an increase in the tissue thickness, but the increase in attached and keratinized tissue is not always predictable. With connective tissue, you can achieve root coverage more predictably, which is obviously an aesthetic advantage, not just in terms of root coverage, but also the way the connective tissue graft heals looks much more natural and more seamless compared to the free gingival graft. Also, from a donor site pain point of view, the morbidity is less with the connective tissue graft because we are harvesting the profound, the deeper layers of the palate as compared to the free gingival, where we harvest the superficial layer. So it's more painful for patients to undergo a free gingival graft compared to a connective tissue graft. So these are the qualities, the main qualities, in my opinion, for both procedures. Let's talk a little bit about the disadvantages, the cons. We talk about a free gingival. The aesthetics is not ideal. You'll always see the demarcation line between the new and the old tissue. Sometimes these tissues, grafts look more patchy, more thick, more scarred. So aesthetics is not a forte of the free gingival graft, although there are good ways that I'm going to show you how to make the free gingival grafts look more aesthetic. Number two, and that's significant, the pain the patient is experiencing with the free gingival graft is much more severe than the connective tissue graft because, again, we are harvesting from the superficial layers of the palate. There is some scarring involved, and tissue also looks scarred, which can compromise the blood supply in a secondary procedure if you're trying to mobilize the tissue coronally. And if we talk about the connective tissue graft, it's extremely hard to execute it when you have mucosal and frenum pull because in connective tissue grafting, you are mobilizing the tissue in a coronal direction and using your sling sutures and creating some releases. And when you have the tissue working against you, it's very challenging. Very often doesn't work. Number two, it becomes a little bit technique sensitive, not just in terms of the tissue harvest from the palate, and I hope you're now familiar with the 6 incision technique. It's also hard to manipulate and suture to the interproximal tissue and insert it if you're using a tunneling technique. Not always easy to separate the tissue if it's thin. So it's not impossible, definitely doable, and we do this on a daily basis. However, it's a little bit more challenging, a little bit more tricky, and it requires more training. Sometimes there's a higher risk of perforation, although the connective tissue itself is a very forgiving procedure, but there's a high risk of perforating or tearing the tissue because it's so thin and undermining the frenum. So that can happen. And many times for connective tissue grafting in these types of situations for lower incisors, just because of all these challenges, we will need to resort to a two-step approach where in the first step we'll improve the tissue quality, and in the second surgery we'll mobilize the tissue coronally, which is an additional surgery for the patient, and sometimes even doesn't work that well because the tissue is now scarred and we have still some challenges with that. So the connective tissue is not always the ideal treatment for the lower incisors. So you can tell that both the free gingival and the connective tissue grafts have pros and cons, and I'd like you to consider them when you're making a decision treating the lower incisors and in general. I hope this is very clear. I hope this was helpful to you. If you found it valuable, feel free to share it with other dentists. Leave me some comments if this is not 100% clear. And in part 3, we're going to talk more specifically about my recommendation and the flap design. So see you then.